Hello everyone, I welcome you to another lecture on dermatology. Here I am going to tell you about type 1, 3 and 4 hypersensitivities. We will also be seeing in brief about the differences between vitiligo, albinism, freckles, FLH, lentigo and dark skin individuals. So let's see about the perianal conditions before we go into hypersensitivity. So in perianal condition, what is Crohn's disease? Crohn's disease is the inflammatory bowel disease which attacks from the mouth to the anus. And there is transmural inflammation within. This can lead to perianal abscesses as well as a fistula. Because of the associated transmural inflammation, there can also be inflammation elsewhere which can lead to perianal abscess as well as fistula, and this presents with bloody stool episodes. What do you know about anal fissure? Anal fissure is the one which is present posteriorly in the midline, and it will be presenting with excruciating pain as well as tenderness. It will be such that the patient will not allow physical examination, will not allow the area to be touched. That much severe will the pain will be. On physical examination, perianal skin tag can be visible and a sitz bath is the treatment. In question vagueness, this can be given as 46-year-old male who has pain during defecation and a perianal skin tag is visualized on physical examination. When there is a skin tag which is visualized, that is an indicator that anal fissure can be present inside. The patient won't allow rectal examination due to excruciating pain. What is the diagnosis and what is the treatment? Diagnosis is anal fissure which is present usually in the midline posteriorly, and the treatment is a sitz bath. What is a pilonidal disease? Pilonidal disease is so to know what is a pilonidal disease, what is a pilonidal sinus? That is a chronic skin condition that will affect the area between the buttocks, that is in the natal cleft. There will be a small dimple-like opening in the skin that leads to an underlying cavity or the tunnel. Otherwise, there can be a simple dimple-like opening. This is the pilonidal sinus. When there is an abscess in the pilonidal sinus, then it can lead to pilonidal disease. Why should there be an abscess? This is because of the hair that will penetrate the skin, causing an inflammation or an infection over that pilonidal area, resulting in the pilonidal abscess. There is a painful 2 cm mass which is located at the superior aspect of the gluteal cleft. How do you treat it? Surgical closure of that pilonidal sinus itself is the treatment. What about hypersensitivity reactions? First, let's see what is type 3 hypersensitivity. Type 3 hypersensitivity, there is an immune complex formation. What is what is an immune complex? Immune complex is when the antigen and the antibody combine and forms a complex. It is known as an immune complex. What is the antigen here? The antigen here can be anything. It can be an injection, it can be a foreign body, it can be anything for that matter. When the body recognizes that antigen as foreign and develops an antibody such that this antigen and antibody combines and forms an immune complex, then the type 3 hypersensitivity happens. This immune complex can get deposited anywhere. If it gets deposited in any part of the body, it results in a systemic infections, like say if it gets deposited in the knees, then it can present with a polyarthritis. When it presents systemically like a polyarthritis, then it is known as serum sickness. But sometimes when an injection is given and that substance which has been injected into the body develops an allergic reaction, that is antibody immune complexes are formed, and that immune complex, that is the antibody for that material present in the injection. So antigen and antibody, it forms a complex, right? So that complex, when it gets deposited in the injection site, then it forms the Arthus reaction. That is, it gets deposited in the local site itself. That forms an Arthus reaction. So this is called as Arthus reaction, where there is a red rash at the injection site. This appears 3 to 5 days after IM injection. Similarly, the polyarthritis that develops after the injection or the drug or the infection is the serum sickness. Serum sickness is basically the systemic infection. So the important concept here is both takes days to appear, because for the immune complex to form and then to get deposited, and then for the symptom to appear it takes days to form. So this is the key feature to distinguish it from type 1 hypersensitivity or the anaphylaxis, where it forms immediately. So the question vignette will be like, a middle-aged female receives IM ceftriaxone and oral azithromycin for pelvic inflammatory disease. 3 to 5 days later, she has red rash in the area of the injection. So when the immune complex is deposited in the area of the injection, then it is known as Arthur's reaction. But whereas similarly, as middle-aged lady receives IM ceftriaxone and gets polyarthritis a few days later. Now, what does this mean? The immune complex has get deposited in the joints, resulting in polyarthritis. So, what is the diagnosis? Diagnosis is a serum sickness, which is a type 3 hypersensitivity. Similar to type 3 hypersensitivity, just like what we have seen, there is another two important conditions. One is malar rash. Malar rash is a classical SLE presentation. Here, the reason for the malar rash over here is immune complex deposition in the facial prominence, that is in the malar area. There is another condition also similar to malar rash seen in SLE, that is post-streptococcal glomerulonephritis. What happens here? Here, the streptococci has entered the body and the body has started produce antibody against it. Now that immune complexes is deposited in the kidney. So it is not because of the infection. The infection has only entered the body and the body didn't fight the infection and push it away, but instead it has formed immunity against it and it has formed a complex with that antigen, and that complex it gets deposited in the kidneys, resulting in a post-streptococcal glomerulonephritis. Actually, it is resulting in glomerulonephritis since it is occurred following a streptococcal infection. The condition is called as PSGN, post-streptococcal glomerulonephritis. So the SLE, as malar rash is seen in SLE, SLE has other hypersensitivity reactions too. So malar rash is seen in SLE as well as post-streptococcal glomerulonephritis is the key it resembles type 3 hypersensitivities. What is dermatomyositis? Dermatomyositis is a condition where there is increased T cell infiltrate in the muscles. So see, dermatomyositis. So the myositis, the muscles are all inflamed. Why? This is because of the increased T cell. It is also an anti-autoimmune condition where there is increased T cell infiltrate in the muscles. So first let's finish the myositis part. So since there is increased T cell infiltrate in the muscles are all inflamed and it is painful. So the muscle biopsy will show T cell infiltrate. And since the muscles are involved and inflamed, it will result in increased serum creatinine kinase. This is an autoimmune condition and it is associated, it has to be associated with antibodies. This condition is associated with anti-Jo antibodies. In addition to it, there is three important dermatological features which we see in dermatomyositis. First one is the heliotrope rash. Here the eyelids will be violaceous. There will be typical violaceous eyelids and there will be a shawl sign. Shawl sign is a characteristic rash pattern which is seen in the back of the back that is in the scapular area where the shawl is worn. The third condition is the Cotron's papules, which are also known as mechanic hands because of the rough surfaced scaly appearance which is seen on the extensors. So dermatomyositis will have both the skin manifestations along with the muscle weakness. What about vitiligo? Vitiligo is a condition as you see here. This is the normal skin, but here it is hypopigmented. It is very pale. It is white. Why? This is because of the antibodies that are developed against the melanocytes. So in this area, the antibodies have destroyed the melanocytes. Therefore, the melanin production is absent in the affected areas because of the T cell mediated autoimmune destruction. Since this is an autoimmune disease, vitiligo can be associated with other autoimmune conditions as well as IgA deficiency. What about albinism? Unlike vitiligo, where a part of the body is alone hypopigmented or white, in albinism the entire body is white and sometimes the iris colors are also changed. So instead of the normal black or the brown or even blue, the iris is pink in color. Why? This is because here the melanocytes number will be normal, but because of the enzyme defects, the melanin production will be abnormal or it will be decreased, resulting in an extremely fair skinned child born to a normal parents. This is associated with certain conditions like phenylketonuria, Chidiakigashi disease, or a tyrosine kinase deficiency. This is a condition known as freckles. It is also known medically as ephyllites. Colloquially, it is known as freckles. People will be having this. This is due to increased melanin pigmentation while the melanocyte number is normal. If you see the pigment is heavy, right? So you can remember it as increased melanin pigmentation. What increases the melanin to be excessively produced by the melanocytes? UV light exposure does this. This can be seen mostly. This is the basis is genetic association. It is seen in fair-skinned individuals who have a genetic predisposition for this condition. What about lentigo? Lentigo is a spot similar to this. This happens in old age too. Here they will be here in ephyllites or the freckles. They did have a normal melanocyte count, right? But here the melanocytes will be increased. There will be no change in the melanin production rate, but in those area which is dark pigmented, the melanocyte is increased. This is the difference between freckles as well as lentigo. Again, this also happens due to chronic UV damage as well as with age, but the difference is there is increased melanocyte over here, but in freckles there is increased melanin production. In dark skinned individuals and light skinned individuals, what is the problem? In both the individuals, the melanocyte number will be the same in both the dark skin as well as light skinned. The melanosome is that intracellular organelle which is present. That number will be increased in dark skinned individuals. But in fairer people, the melanosome number will be decreased. The melanosome will be larger in size and the melanin degradation will be slower. But what we need to know is the melanosome number is increased, thereby resulting in the condition. What do you know by crest? Crest is the limited scleroderma, where it is associated with C stands for calcinosis cutis, that is the calcium deposits in the skin. R stands for Raynaud's phenomenon, that is color change following vascular spasm. E stands for esophageal dysmotility, that is reflex symptoms. S is sclerodactyly, skin tightening of the digits. T stands for telangiectasia or the dilated blood vessels. How will this be asked? They can give you some features of indicating this, and they can ask you what are they more prone to, or what is their more higher risk factor to. So this can be associated, it can lead to pulmonary hypertension secondary to pulmonary fibrosis. Even though the diagnosis is limited scleroderma, it can progress to pulmonary hypertension due to pulmonary fibrosis. What is Plummer-Vinson syndrome? Plummer-Vinson syndrome is a characteristic triad. Because of the iron deficiency anemia, it can result in angular chelosis, it can result in spoon-shaped nails, and it can result in a web which is present in the esophagus, resulting in dysphagia. What do you know by atopic dermatitis or eczema? Atopic dermatitis is that excoriations which are seen in the flexor regions. How is the physical finding? So this allergy, that is the atopy, can result in asthma too. Asthma also can be due to allergy, right? So it can result in a asthma where they will be having predominantly cough, not wheezing. And they will also be having an atopy, that is in the flexor regions they will be having this irritation. So atopic dermatitis patients have cough variant asthma, which they have a dry and a worse cough in the winter, and this is type 1 hypersensitivity along with excoriations in the flexor regions. What is the treatment? Oil based emollients will help. It will help to reduce the itching, and topical corticosteroids will also help because this is mainly allergic. This is a concept about superinfection in eczema. Here you need to know, here an 18-year-old female is having a history of eczema and the area over the elbow is red and inflamed and oozing too. Now the eczema will need not be present oozing, right? Now why the question continues. 6-year-old sister recently had weeping papules on the face. What is the diagnosis in the 18-year-old? Since the 66-year-old has a weeping papule, it can be because of impetigo caused by Staph aureus or group A streptococcal infection. Due to inoculation from the younger sister's impetigo, the elder sister must have got group A streptococcal infection or Staph aureus infection over eczema, thereby resulting in superinfection. So this is the concept about the superinfection in eczema because of the constant itching and touching of various places, and again itching the similar eczematic site, and it can result in a superseded infection. What is urticaria or hives? Urticaria or hives is what it is per se. In any allergic reaction, a type 1 hypersensitivity, whatever it is, first what will happen? There will be itching. The medical term for itching is pruritus. What is urticaria then? The associated wheal or the raised flare or the skin condition that is associated with itching or with type 1 hypersensitivity or with allergic reaction is known as urticaria, colloquially called as hives. Now, what is the reason behind urticaria? It is type 1 hypersensitivity. How will it look? It will look raised erythematous wheals which are intensely pruritic. How long will it be present? It will generally be transient. Individual lesions will resolve within 24 hours. The best way is to avoid itching it. It can be precipitated by various allergens, including pollen, pet, as well as the drugs. Medications such as antibiotics like erythromycin all can even result in urticaria. What do you know about contact dermatitis? Contact dermatitis can occur due to many reasons, but what is it? Contact dermatitis is known as delayed type hypersensitivity or type 4 hypersensitivity. When a metal or when an unwanted allergen touches it, or whatever the allergen that the body considers unwanted, that is when that allergen touches the body, then it response, a T cell mediated immunity is triggered. Like that allergen is taken inside the body, and the body mounts a T cell mediated response, thereby there will be skin reactions. So here if you see, this is because of a poison ivy or sumac, where the linear vesicles are highly characteristic. Following exposure to a poison ivy, the patient will develop linear vesicles. So this is because of contact dermatitis or a type 4 hypersensitivity. Here on the other hand, if you see, they are wearing a watch, and the watch has a nickel in it. The vesicles on the wrist from watch contact will result in type 4 hypersensitivity. It can even occur in people who wear gloves. So that is a latex allergy is also an example for type 4 hypersensitivity. So in vignettes, they will give you like a middle-aged man went hiking, used sunscreen all over the body, but has linear vesicles on the legs. What is the best way to prevent this condition? The linear vesicles on the legs is somewhat similar like this. This is because of exposure to the poison ivy or sumac. So, and the body has mounted a type 4 hypersensitivity. How will you avoid it? Avoidance of contact with the weeds is the treatment to avoid this. Linear vesicles is a huge high yield descriptor for poison ivy. If they had wanted you to tell that, if they want you to think that it is due to sunscreen, then since they have applied a sunscreen on all over the body or in exposed areas, they would have given that there is a rashes on the dorsum of the hands, palms, as well as face or everywhere. So, but that is not here. It clearly says that there are linear vesicles on the legs following hiking, which is due to poison ivy. The second one will be so they have won a watch, and what it is due to, it is because of the nickel which is present in the watch. And the third one is a latex allergy because of gloves. What is type 4 hypersensitivity? That's what the T cells will recognize the antigen, but there will not be no immediate symptoms. Subsequent exposure, sensitized T cells will activate and they will release inflammatory cytokines. Macrophages will also be recruited, tissue damage occurs, and the symptoms will appear after 24 to 48 hours. But in type 1 hypersensitivity or atopy, the symptoms will appear immediately. In type 3 hypersensitivity as well as in type 4 hypersensitivity, it will take time for the symptoms to appear. That is, the symptoms will appear after 24 to 48 hours. What are some more examples of type 4 hypersensitivity? So first one is we had already seen about contact dermatitis. So in addition to it, Steven-Johnson syndrome is a type 4 hypersensitivity. What is Steven-Johnson syndrome? It is an autoimmune type 4 hypersensitivity that results from detachment of the skin covering. When there is less than 10% surface area of the body skin is detached, then that is known as Steven-Johnson syndrome. Nikolsky sign is when a pressure is applied over the skin, then there is slowing of the skin with the friction. That is seen in, that is the slowing of the skin, which is Nikolsky sign, is seen in Steven-Johnson syndrome. What is toxic epidermonecrolysis? That is when more than 30% of the skin surface is slowed. That is known as toxic epidermonecrolysis. Less than 10% is SJS or Steven-Johnson. More than 30% is toxic epidermonecrolysis. 10 to 30% is an immediate form which is caused by sulfa drugs as well as anti-epileptics like lamotrigine. So this is Steven-Johnson is one example for type 4 hypersensitivity. Chronic transplant rejection, T cell mediated response against the transplant, that is a foreign tissue, is also a type 4 hypersensitivity. Tuberculosis skin test, MAN2 test evaluates prior TB exposure. Raised bump will indicate type 4 hypersensitivity. And contact dermatitis, poison ivy, nickel, and latex allergies are also type 4 hypersensitivity. This is in short about the presentation. I hope I have made it clear. Thank you for listening all this while. Have a good day.